Oh, it's very widely available now because there's a TVT registry in the United States. There are more than 370 centers in United States and likely to expand. There are some data to say that volume-related outcome differences exist. This is a common question that comes, that why should I come to Cleveland Clinic and not go somewhere else? And of course, it is related to your personal resources and personal family support and things like that. So when you travel at a certain age and come to a different place, that is difficult at times for the patient and for the family. But what is the difference? The difference is several-fold. The most important is that first you should have all the options available. And the availability of the option is at times difficult to understand if you've not lived through all the options. So if surgery is an option, balloon valvuloplasty, valve replacement. And Cleveland Clinic is a little bit unique in the sense that we all work as a team. We are all financially de-incentivized in the sense that we are all salaried. So doing a procedure one way or the other does not really make any difference to the physicians. So which is unique in that sense. That's the first part. Then the procedure and the team. So it's not just the doctor, but the infrastructure, the facilities, how to deal with the complications, surgeons, anesthesiologists, imaging doctors, all of this, even residents and fellows, are all critical element for their care. So at night, if you have a little low blood pressure, and the fellows are going to call and make sure that everything is teed up and there is no loose end. So it's not like wait till the morning to figure out that what is happening when I go around with them. So there is a tremendous amount of infrastructure that exists because we deal with so many open heart surgeries, so many heart patients. And then finally, the follow-up part is, I think, also very important because whatever we say, we have complications. We have people at this age are on thin ice in the sense that if you have one complication, you can pay large penalties. So trying to prevent the complication, understand the complication early, treat the complication early, are all very important part of the proper outcome. So if people report the outcomes, people are very careful about and passionate about doing these things, then it makes a difference. I get a lot of patients calls, family, friends, a lot of people call and say that, we cannot make it, can you look it over the charts and tell us? So we do that too, it's whatever best way we can help. The idea is that large centers do have a difference, in my mind, in terms of their outcomes, in terms of their approach to the patients and ultimate satisfaction to the patient and family. Because if something goes wrong, you always wonder that could it have been done better or not. So there's another little piece that is important to recognize. The Cleveland Clinic is a busy place. We have we do about 10,000 catheterizations in our cath lab a year. We do about 4,500 open heart surgeries in our operating rooms. Every night, we have 5 cardiology fellows on call in our Cleveland Clinic. We have 4 cardiologists on call. So it is it's an operation that is 24/7. So at night, we have acute MIs, dissections, all kinds of emergencies, and all the surrounding areas look forward to depending on us. So if they have a complication in the cath lab, they pick up a phone, they say that, we have a complication, can we just transfer? We never say no. So we have all these patients come, and we are proud of it that we can help them if we can. Sometimes we cannot, but whatever the best we can. And the infrastructure exists that in minutes we have all experts available at night. So last night, we had all these acute MIs, aortic dissections, and Dr. Roselli was from surgical side on call with me. I was there, and we could do everything. So we could function Sunday night as if it was, Monday morning, and nurses were there. All the expertise was available and fast. So this is a extremely unique situation that exists.